just wanted to give you an overview of our organization's vision and mission before I dive into the integration process. So we at D3 envision a future where everyone has access to high quality healthcare. And our mission is to improve lives by strengthening health systems through digital technology. A little bit about our work. So we mainly focus on the Jamii Afya project and the Jamii Afya app. And for those of you who are curious, Jamii Afya is a Swahili word, which translates to, a rough translation would be community is health. It's powered by CHT, and the app has been deployed in Zanzibar with a coverage of 50% of the population in 11 districts. Some of the use cases that we cover are ANC, PNT, child immunization, early childhood development, ICCM, and COVID. Apart from the CHT application, there are also plans underway with MEDIC to design and develop a dedicated supervisor reference application. So this will contain dedicated supervisor functionalities. The images on the right are snapshots of our app. So the one on the left shows a task list, which is basically a list of tasks that a CHV is supposed to do. The one in the middle is the People's tab, which shows the households registered by a CHV. And then the one on the right shows the targets that a CHV is supposed to do in a given month. Next up, we'll focus on the integration overview. So before I dive into the how, I just wanted to explain the why. Why exactly did we integrate, or why exactly did MOH decide to integrate with Jamii Afya? So MOH collects data at a health facility level, whereas Jamii Afya collects data at a community level, which is a level 1 below. So the goal of MOH was to consolidate data at a health facility and community level to kind of get an in-depth coverage of data so that they can facilitate better healthcare delivery. So that was kind of the goal of why we did this integration. And I thought it would be easier to go through the how by showing you a use case. So imagine we want to push aggregate data about number of under 5 children visited by CHV, categorized or disaggregated by sex. And our goal is to push the data at a Shahia level on a monthly basis. Now, a Shahia is basically a location below a district level, and that's where our CHVs work and report the data. So the diagram you see below, is a bird's eye overview of the integration process. And it begins by CHV collecting data and then syncing the data. Once the data is synced, it is stored in our database. At this point, we have a script that pulls the data from the database, converts it into a format that is suitable for pushing to DHIS2, and then pushes the data to DHIS2 on a monthly basis using a cron job. So I'm going to be focusing on this third step, not necessarily on the script or the code that we wrote, but mostly on the connection or the mapping between DHIS2 and the data that we have. So in the next slide, we start by creating the organization units, the data elements, and the category option combination. So for our purposes, we said that we are trying to push aggregate data for under 5-year children visited by CHV. So what I did is the image on the left shows you the Shahia. In this case, it's Chachani Shahia. And if you create an element in DHIS2, there is a corresponding ID for every element. So in this case, Chachani Shahia's ID is this one. And then after creating the location, I created the data element itself with its corresponding ID. And also the categorization. So in this case, I'm showing you the male category with its corresponding ID. Now we'll see how these IDs help us to map between DHIS2 to CHT. So that is the first step. The next step now that we've defined the data elements in the DHIS2 and the location, the next step is to create the SQL queries to fetch the data value. So the image on the bottom left is a definition of the SQL query. In our use case, is the number of under 5 children enrolled by CHV. And something important here is the first column, which is the data element name. So every query will have a unique data element name, and this name will be used to map with the ID from DHIS2. And we'll see how we'll do that in the next slide. So the next column is the value column for the data element. And then we have the Shahia, which we said is a level below a district, and then the district, and then the gender. So if I run this query, the result is what you see on the right, the table where you have the district, the Shahia, the data, the unique data element name, the value, and the categorization. So at this point, you have defined the data element in DHIS2, you have defined your queries. Now the question is, how do you map? So that's where we have our mapping file. The mapping file contains two basic things. It contains the Shahia mapping or the location mapping. And this is the mapping of Jamii, Afya, Shahia names with the corresponding Shahia IDs from DHIS2. So that is the image you see on the bottom left here. So I have the name. In this case, in our example, in our use case, it was Chachani with the ID. And if I go back, the ID was ODW, which is here, ODW. And then on the right, you see the data element name column of the SQL query with the corresponding data element ID and category option combination ID in DHIS2. So for our use case, we said we are going to push under 5 enrolled female and male. And so U5 enrolled is the data element name we used in our SQL query, which is right here. So since we said we are going to push female and male, so I have this twice, one for female and one for male. So this ID here, KJ4 represents the female, and then HT4 represents male. So at this point, we have the mapping, and then we convert this into a format that is suitable for pushing. So it is taken care by our script, which then gives us a final version, which is called a data value set file, which looks like this. So for Chachani Shahia, we have its data element ID, which is the under 5 enrolled, the period that we are sending the data, in this case is November 2020, the org unit ID, which is the ID of the Chachani Shahia, the category option combination, which is either male or female, and then the value. So if I push this in DHIS2, it will go under the data element name for this period, and then for this Shahia, the Chachani Shahia. So that is kind of a very high level overview of how we integrated the two systems. And then in terms of challenges and next steps, obviously we had challenges. One of the challenges that we faced was that the CHVs reported syncing issues, and that was either due to broken or lost devices or connectivity issues in some areas. So sometimes there were gaps in our data that we were sending to the DHIS2. But to remedy that, what we did is in the next push cycle, we were not only pushing the data for the current month, but also for the previous 2 months. So that kind of filled the gap, the data gap. The other challenge that we had is sometimes, very rarely, we had server connectivity issues. Couch to PG is down or server is down. So that also, that also hindered led to the gaps in data. But I'm glad now that we have the notifications that we receive from medics. That is good. Last but not the least, we have the changes in indicator or data element requirements. So the requirements for indicators, consistently change as we move along. And when this happens, for example, if we have to add a new data element or a new indicator, then we would have to make sure that we're not only pushing the current data, but the historical record that we have in our database. And whenever there are changes or additions in data elements or indicators, that also impacts our queries. So we have to tweak our queries to accommodate the additional requirements. So these are some of the challenges that we have. In terms of next steps, we want to work on notification system for errors and failures of scripts. So currently, if there is a failure in the script, we'll look at the logs. So it's a manual process. We want to automate that. And then also we want to work on restructuring database to simplify our queries. We're really not happy with the complexity of some of our queries right now. So we have already begun to restructure our database, and hopefully that will simplify the queries that we have. And that is the end of my presentation. Thank you very much for listening, and back to you, Anthony.